Now I would like to request Dr. Antonina Ihde ma'am to give an orientation lecture, that is the need of an hour. Dr. Antonina Ihde.
Just a short technical question to solve, and we will continue with the lecture about prosthetic work on strategic implantology. We now try to run my PowerPoint from the computer number 3. Thank you very much for waiting. So now we're starting with the last lecture. So today I'm starting with the prosthetic work on strategic implants, which the lecture will continue the day after tomorrow. So here are our typical patients which come to our clinic on the daily basis. For example, this lady, a 60-year-old lady, she was on holiday, and she was on holiday with her boyfriend, and then her upper bridge broke. She needs immediate help and solution from us. This lady suffered for many years from the severe periodontal infections, and she simply didn't dare to start the treatment because she was afraid of healing time, so she simply was really suffering. This patient, he was looking for the doctor finally to solve his dental problems, because all teeth already came on the border for losing or trying to do something still with them for a few years, but still lots of problems with this dentition. This patient, social worker, his upper jaw bridge broke, and he needs help immediately. So he needs to chew, to smile, to talk to people. One more cases like this. All these cases which I showed you, this type of people, they come to us every day, and they want from us immediate and reliable solution. All these patients, they still have at this moment fixed teeth on natural teeth, and they want to have a smooth transition to the fixed teeth but on implants. And if these patients will, so psychologically they are not ready to go for the healing time, for the bone augmentation. They are not ready for all this long waiting. And even if they would do this, there would be still the danger that perimplantitis would take place after their treatment is finished. So these patients, they actually don't have to wait, because they can get this immediate solution. And we give this solution with the strategic implant technology. This is the technology when the patient gets immediate function loading. So we finish their work within 3 days. Then there is no need for bone augmentation. Whichever bone is present for the patient, we use this bone. No any healing time is needed, and no perimplantitis later will be expected. So these are our typical patients. There was some nice video which, sorry, it cannot run. So these are the typical cases which the patients come to our clinic. The lady before the treatment and 3 days after the treatment is finished. The whole concept of strategic implant technology, it arrived not from dentistry, not from dental implantology. All the surgical part, it came from traumatology, regarding the osteofixation, regarding the splinting, regarding the function of the bone. All knowledge came from traumatology, and only from dentistry, the theory came from the idea about occlusion and mastication for the removable dentures. So these are the implants which we use in daily practice, typically for this work. And for this work which we do, whichever prosthetics we do, whichever patient comes to us, we always follow 2 main principles. So we create for the patient bilaterally equal mastication and lateral pattern of chewing. It means that whether the patient